Hey people, I'm back with another 7 marker question from the subject of oral medicine, which is enlist the oral mucosal lesions associated with the use of smoking and smokeless tobacco. Write in detail about etiopathogenesis and management of oral leukoplakia. The lesions which are associated with smoked tobacco are leukoplakia, erythroplakia, smoker's melanosis, nicotinous stomatitis, squamous cell carcinoma, hairy tongue, and chronic periodontitis. Lesions associated with smokeless tobacco are tobacco pouch keratosis, leukoplakia, gingival recession, dental caries, squamous cell carcinoma, periodontal disease, and nicotinous stomatitis. There are 10 etiological factors which may be responsible for leukoplakia, which are smoking, alcohol, human papillomavirus, candidiasis, sharp tooth, sunlight, genetic, nutritional deficiency like vitamin A and B, immunosuppression, and sanguinaria. Talking about the pathogenesis of tobacco, tobacco is derived from the leaves of Nicotiana tabacum and Nicotiana rustica. It is used in two forms, that is smoked tobacco like cigarettes, BD, Dhumti, etc. and smokeless tobacco like henny, gutka, mawa, etc. Tobacco either in smoke or smokeless form is the main etiological factor. It may act in three ways. First, the carcinogens may bind to epithelial DNAs, damage the DNA, and cause DNA mutation, which may lead to dysplasia or malignant transformation of a cell. The second way is that carcinogens form highly reactive radicals, or there may be free radical formation, which may lead to damage of the cell membrane, cause DNA fragmentation, tissue damage, and alter the cellular antioxidant defense system, which may cause dysplastic changes and keratinocyte stimulation, which may further lead to hyperkeratinization. Third way is the heat from the smoke and frictional irritation from the smokeless form of tobacco may cause keratinocyte stimulation as a protective response, which may further lead to hyperkeratinization. Pathogenesis of alcohol. There is known to be a strong synergistic effect on oral cancer risk when a person is both a tobacco chewer or smoker and drinker. Different mechanisms are that alcohol increases the permeability of oral mucosa, which facilitates the penetration of the carcinogens into the tissue. Second is that normally liver enzymes inactivate the carcinogens by hepatic clearance. However, chronic alcohol intake may result in liver cirrhosis, and as the liver damage may activate the carcinogens. Heavy alcohol consumption can also cause nutritional deficiency, which increases the risk of developing an oropharyngeal cancer. Alcohol use has been identified as a major risk factor for cancers of the upper aerodigestive tract. Cancerous cell may metastasize to oral cavity. Chronic alcohol-induced immunomodulation, largely a suppressive influence on the cellular immune system, may be an important risk factor for oral and esophageal cancers. Alcohol is also a folate antagonist, and folate has an important role to prevent carcinogenesis. Candida causing leukoplakia works by releasing nitrosamine-specific protoncogene, and it also efficiently converts ethanol into carcinogenic acetaldehyde in alcohol drinkers. This way, it also has a synergistic effect with tobacco and increases the dysplasia and chances of leukoplakia. Talking about the investigations, there are chairside and laboratory investigations. Chairside investigations include the conventional investigations like the cytosmear, vital staining. Advanced investigations include chemiluminescence, Visilight, well scope, Laboratory-based investigations include biopsy, biochemical, salivary investigations, and genetic markers. Leukoplakia. First of all, topical antifungal agents like clotrimazole, which is a candida cream, is given for thrice a day for a week. If there is reduction in size, then the topical antifungal agent should be continued for 1 month. If there is no response and the lesion is less than 1 centimeter, then we should go for excisional biopsy. However, if the lesion is more than or equal to 1 centimeter, incisional biopsy should be done. If the dysplasia is absent in the histopath examination, then retinol A, which is a vitamin A analog, ointment application should be advised twice a day for 1 month. If the dysplasia is present, then we can go for either total excision of the lesion with graft and follow up once in 6 months for 3 years. But if excision is not possible, then capsules of lycopene 4 mg twice a day or 8 mg once a day can be given for 3 months. Capsules of antioxidants with selenium twice a day for 6 months can also be given, and topical bleomycin 1% weight by volume thrice a day for 15 days should be given. General considerations. All possible agents which lead to white keratotic lesions should be eliminated, such as any sharp tooth or candidal infection, so as to rule out other definable lesions. In persisting lesions or absence of any possible causative factor, biopsy should be taken to exclude histologically the presence of a definable lesion and to establish the degree of epithelial dysplasia. Up to 60% of leukoplakias regress or totally disappear if tobacco use is stopped. Of habit. Every clinician should follow the 5A principle to quit the habit successfully. Ask about tobacco usage every time. Advise tobacco users to quit. Assess the willingness to make a quit attempt. Assist and provide help to move the individual towards a successful quit attempt. Arrange follow-up. If patient is interested to quit, possible replacement measures should be educated and motivated. The proved pharmacological replacement of tobacco cessation are bupropion 150 mg twice daily for 2 weeks, or varenicline 0.5 mg daily for 3 days, 0.5 mg twice a day for 4 days, and then 1 mg twice a day for 11 weeks. Nicotine replacement therapy. It helps smokers during the withdrawal process by replacing a proportion of the nicotine which was formerly obtained from cigarettes. The commonly prescribed formulations are nicotine gum, nicotine patches, nicotine inhaler, and nicotine nasal spray. Management includes the carotenoids and retinoids like beta-carotene, vitamin E, selenium, canthaxanthin, astaxanthin, and phytoene. The doses of following drugs are vitamin A 75,000 to 3 lakh international units per day for 3 to 18 months. 1,3-cis retinoic acid 1.5 milligrams per kilogram per day for 3 months, followed by 0.5 milligram per kilogram per day for 9 months. Beta-carotene should be given in the dosage of 30 milligrams daily for 3 to 6 months. Fenretinide, which is a synthetic retinoid, is given in the dose of 200 milligrams per day. It reduces the relapse and appearance of new leukoplakias. Vitamin E should be given in the dose of 800 international units per day. Topical chemotherapy involves the use of podophyllin solution or bleomycin, 0.5 to 1% per day for 12 to 15 days. According to some studies, these drugs have induced some regression or even total resolution of dysplasia and of clinical lesions. Alternative modalities of treatment involves the green tea 3 to 4 times a day for 3 months. It has anti-inflammatory action, antioxidant action, and anti-carcinogenic action. Lycopene in the dose of 4 to 8 milligrams a day for 1 month is also beneficial. Curcumin in the dose of zero point 0.5 to 1.2 grams per day for 3 months can also be given. Coming to the photodynamic therapy, it involves the administration of a photosensitizer dye, which is 5-aminolevulinic acid to the body. There is selective uptake of this dye and retention to the tumor site for a long time. This dye is activated by exposure to light of a specific wavelength in the presence of oxygen. Activated photosensitizer will result in the formation of toxic oxygen species like singlet oxygen and free radicals. These highly reactive chemical species can damage the cancerous cells by damaging their intracellular organelles. Surgery can be done using scalpel, cryosurgery, which involves the use of liquid nitrogen, nitrous oxide, and carbon dioxide. It is a type of surgery that involves the use of extreme cold to destroy abnormal tissues such as tumors. Last one is the laser surgery. Leukoplakia is usually treated with the help of carbon dioxide laser and diode laser. Leukoplakia can be treated by two techniques, which are laser ablation and laser excision. That's it. Thank you for watching. If you like this video, please subscribe to my YouTube channel. Stay tuned for further videos.